Yeah, the answer is yes. I want to thank Governor Cuomo. I think the fact that he has put Puerto Rico on his radar, on his administrative and political and public policy radar, and the fact that he sent Kathy, his lieutenant governor, and a team of people, high-level officials, to help us in the area of healthcare, I think it's important. It's very important because it basically allows a number of public officials to understand what are the problems in Puerto Rico. And I think what came out, and I met with a group, I had dinner with a group, and what came out of that meeting was the fact that many of Puerto Rico's problems, New York had them a number of years ago. And the question then becomes, how did you solve the problems? And they did share some of those thoughts and ideas. And of course, at the end of the day, it has to do a lot with leadership and the idea that, we have to solve problems, and problems have to be solved if we have the right recipe. So I am convinced that Governor Cuomo, I understand, will come back to Puerto Rico in the next few weeks.
I hear he's going to be here for the Somos conference.
And he will be here for the Somos conference. And during the Somos conference, in fact, we moved a big rally we're going to have for healthcare on November 5th. And we're expecting everybody from the diaspora, from New York, to participate on that rally. I think the governor will be participating. Many religious groups in Puerto Rico will be participating. The Senate and the House, and I understand the executive, will allow the day for our workers to participate. We want to have a huge rally, basically to claim that Puerto Ricans, there's no reason why to treat Puerto Ricans as second-class citizens when it comes to healthcare. Puerto Ricans are paying their Social Security for Medicare just like anyone in the United States. Yet we're getting reimbursement rates at 50, 60% of the rest of the states. And that's creating chaos in our healthcare system. And there's no reason why that should happen. This is the most, Medicare is the worst unfunded mandate of the US government. Why? Because our hospitals and our doctors are required to offer certain quality of services, yet we're not being reimbursed for those services. So who gets to pay for it? The state government that is absolutely bankrupt right now. That makes absolutely no sense, and I really encourage everyone who's watching this to make sure they participate on this rally on November 5th.